welcome to the Oral Health Education Series, Module 9, Navigating the Dental System, Part 2. I'm Dr. Becky, and I'm here with Ready, Set, Smile for the last part of this complete oral health education series. Let's review what we talked about in Part 1. Healthcare can be divided into coverage, access, and utilization. Remember, each of these three entities are necessary, and together they're sufficient for one to achieve healthcare. We've reviewed coverage in the last lecture, which is complicated. Dental coverage is less common, is often separate from medical coverage, and it does not cover all necessary treatment. So if I have dental coverage, it means I will have access, right? No, that's incorrect. Access to healthcare. This is described as the ability to visit a provider for preventing or curing medical problems. So just because one has coverage for healthcare does not mean that they necessarily will access it. So what are some key factors for access to dental care? Well, insurance coverage is a big one. But others include the geographic location. Are you too far from a dental clinic? Cost or finances. Can I maybe not afford to go even if I do have coverage because I know I'll get a bill? Transportation. Maybe I don't have a way of getting there. Cultural barriers, or even just the available services might not be in your area, like, for example, specialty care. There's a lot of different factors. This isn't a comprehensive list. But what if I don't have dental coverage or I can't afford it? Well, it still means that you can access care. For more urgent needs, the emergency room or urgent care are really the place that should be prioritized. And unfortunately, this is the way that a lot of people need to first step into the dental sphere. For non-urgent needs, there are free care programs. We'll get into these later. Free care clinics or events, or even more affordable dental clinics that have like sliding fee scales. So most importantly, if you don't have coverage, still please do seek care if you need it, and encourage your patients or friends, colleagues to do the same. The emergency room. Many people have no other option but to use emergency services, which results in 1, a high expense, 2, limited care. Not all dental services, or most dental services, aren't available in emergency rooms. So what does that mean? Well, antibiotics and pain medications typically become the standard for those who do present to the emergency care with dental needs. 3, the root of the problem persists. Yes, you still must visit a dentist or a surgeon. However, just keep in mind that this is the recommended action for acute dental infections if no dentist is accessible. They can be a life-threatening emergency. So please don't delay care and use these resources if you need them. What are some barriers to access? Well, again, we've talked about insurance coverage, but others include maybe providers not accepting their insurance. Again, geographic location can be a large barrier. Cost or finances, transportation, cultural barriers, or again, a lack of available services. The crux of the matter? Well, those with more limited access to care are typically those who need it the most. So let's review some examples of barriers to access. We'll talk about nursing homes, rural America, and provider shortages. Nursing homes and dental coverage. It is a federal law that nursing home facilities are required to provide routine and emergency dental services for their residents. But in most nursing homes, 80% of residents do not receive dental care. About 84% have difficulty performing oral hygiene tasks on their own, and this comes from a study in 2017. Now, some nursing homes may be great at helping their residents to achieve access. However, this is not a well-enforced law, and unfortunately, nationwide, it is a big problem for nursing home residents. Next, let's talk about rural America. 60% of dental health profession shortage areas lie in rural areas. Now, not only do these areas face a major shortage of dental providers, but they also struggle with things like limited education of oral health, lack of fluoridated water, geographic barriers to healthcare, like far distances, poverty, a lack of transportation, and reduced coverage. So it is a big problem. Again, there's a big lack of specialty care in rural areas as well. So rural Americans do face barriers to access. And lastly, we'll talk about Florida and Medicaid, a case of dental coverage in children. With the trip to the Supreme Court, Florida versus Health and Human Services, in 2005, children enrolled in Medicaid were not able to locate dental providers. Thus, Florida's American Association of Pediatrics and American Association of Pediatric Dentistry filed a lawsuit against the Florida Healthcare Administration. So reimbursement rates for dentists were subsequently raised. The issue here was the children had care. They were covered by Medicaid. However, they weren't able to find a dentist who was willing to accept their insurance. Why? Reimbursement rates for Medicaid are renowned to be very low. So in this case in Florida, the reimbursement rates were raised. In 2016, nearly all Medicaid recipients in Florida were offered comprehensive dental care. And this is a huge achievement for Florida. The Ballad of Medicaid. So as of 2015, only 38% of dentists accepted Medicaid patients. And most providers limit, and sometimes greatly limit, how many Medicaid patients they will see. This is not enough to care for the number of Medicaid beneficiaries that we have in this country. But why is this? Is it because they don't want to? Well, dentists are reimbursed extremely low for Medicaid compared to private insurances. And that's something that, is a huge area where we're working to change that. In comparison to private insurance, Medicaid reimbursements can be 20-some cents on the dollar compared to private insurances. So it really is a big problem. So how do you know who accepts your insurance? Well, if you have public insurance, visit your state's website or Insure Kids Now /find a dentist. The best actions that you can take are contact your insurance carrier or contact individual offices. Just ask. The more investigation you do, the more you'll learn, and the more likely you'll be able to find and access care. So what are some ways to improve access? There's a lot of them. First, expanding the workforce. More dentists, more mid-level practitioners like dental therapists. Improving coverage. Establishing rural loan forgiveness programs for dentists to encourage them to move to areas where there might be a shortage of providers. Increasing Medicaid reimbursements. Expanding Medicaid coverage to include adults as well. Integrating dental care with medical care. Creating mobile dental clinics like buses or portable clinics in non-traditional settings like schools, pharmacies, WIC centers, public transportation systems, or even offering translation services, which all offices should do. So if one has coverage and one has feasible access, will he or she follow through and pursue care? Well, not always. The door might be there and it just needs to be walked through. What is healthcare utilization? This is described as the use of services for preventing or curing medical problems, and this is the third entity for achieving care. Utilization of dental services. Dental care utilization has declined in the 20th century due to a decline in dental caries, mainly among children and working adults. That's great news! But for older adults, utilization has increased. Americans are growing older and retaining their teeth for a longer duration of time, which is fantastic. But this means that the need for dental services and prevention is increasing even more. So what are some barriers to utilization of dental services? Well, there's cost and finances. There's the lack of oral health knowledge, cultural perceptions of oral health, no desire to resolve tooth issues, overall fear of the dentist, maybe lack of time, or the lack of health or dental coverage, or lack of access to care. And the last two, of course, we've reviewed. So what are ways we may improve utilization of dental services? Thinking about increasing access to care, increasing coverage of care, changing cultural perceptions of oral health, integrating medical and dental care so that it's easier for patients to utilize, educating children and families about dental care and the importance, and moving dental care to other locations like hospitals and schools. Coverage, access, and utilization. Each entity is necessary, and together they are sufficient to attain healthcare. So just a quick stop to look at prescription coverage. What if the dentist prescribes something? Prescription costs are typically covered through medical insurance. So whether one has insurance or not, basic prescription costs may be unaffordable and a major barrier to improved oral health. So this is another thing to really keep in mind when you're either working with a dental office or you're the one seeking care. Just that sometimes the prescriptions are, or all times, the prescriptions are covered, typically under a separate entity. So how do we combat barriers to coverage, access, and utilization of dental services? By creating and changing health policies, public health interventions, and community clinics. There are ways to do this. Free care? So what services exist? Well, this is harder to find. There are things like Missions of Mercy, the Union Gospel Mission, donated dental services, which is something you can apply for online, school-based services, and Give Kids a Smile Day. There are some free services available, but they are tougher to locate. What about reduced cost care? What type of services exist here? I mean, there's school-based clinics, again, there's reduced fee clinics like sliding fee scales, which base what you pay on your income. Dental training clinics, which typically offer reduced cost care. Community clinics like Apple Tree Dental, Community Dental Care, the Care Clinic, or Scenic Rivers if you're in Minnesota. And I do encourage you to look up all those different clinics. Ready, Set, Smile. Ready, Set, Smile is a Minneapolis-based nonprofit which provides culturally competent, educational, and preventative dental services to children and families in underserved communities throughout the Twin Cities area. This is all within local schools. There are 13 early childhood programs and 14 public and charter schools. And Ready, Set, Smile is a great way for children and families to learn about oral health. Not only does Ready, Set, Smile educate and train children about the importance of oral health in their own educational setting, but it also trains caregivers and families. Our Ready, Set, Smile also offers after-school education for parents and families. It's a comprehensive intervention for all children, regardless of income or insurance coverage, and it really is transforming oral health throughout the Twin Cities. So, lastly, we'll talk about models of nonprofit delivery. There are two different tiers. It's charity and justice-based delivery. Charity offers a more traditional model of services, which are typically free, versus justice, which is ethical, traditional, or an innovative model for change. Charity focuses on a workforce based on volunteers, whereas justice-based has a workforce supplemented with volunteers. Charity is finite in place and time, whereas justice offers a complex, long-term intervention in place and time. A charity-based model does not create a sustainable safety net, versus justice, which does create a sustainable safety net. And lastly, charity demonstrates a need, whereas justice improves outcomes and breaks the chain of disparities. So what does this mean by these two? Does this mean that charity is bad? No. Charity comes from good hearts and places. It's a quick fix, reaching a smaller number of people. And that's just what it is. Some dental programs that offer free care for 1 or 2 days are great because they do allow those patients to achieve care, but it doesn't set up anything that's sustainable or long-term or will help them to achieve care in the future. Justice-based models of nonprofit care, with the intent for longevity and sustainability, they create a meaningful impact that reaches entire communities for the long term. And that's what's important. This is why, while both charity and justice are valuable in improving health outcomes, one is vastly more effective. Practice justice. And that's some of the best advice that we can provide. So looking at, for example, Ready, Set, Smile, they really embrace that practicing justice and creating an intervention that not only helps children, but it helps families and changes the cycle. It breaks the vicious cycle of not achieving dental care and enables entire communities to change their behaviors and improve their care. So, underserved groups suffer disproportionately with a majority of diseases, and these groups are also the least likely to have access to care. Even though oral health is integral to one's overall health, dental care and oral health coverage are mostly separate from medical coverage. So, wait a minute. What can you do? You now have the tools to help. First, educate others. Second, contact your legislators. There are many things that we're working on to help enable coverage, access, and utilization of dental care for others. And third, practice justice. Be a part of the solution. You do have the tools to do this. I alone cannot change the world, but I can cast a stone across the water to create many ripples. And that's a quote by Mother Teresa. Thank you for joining us on the journey to improved oral health. We really hope that you enjoyed this lecture series. To receive your oral health educator certificate for completing this course, please complete our survey available through our website. And again, if you have any questions, please do not hesitate to contact me at beckyhuddleston@gmail.com. We are so grateful for our sponsors, and we thank them so much for their help in helping us to create this lecture series, and we truly hope that you enjoyed. Thank you for being a part of this journey.